Joining us on the program, we have Vineeta Mooganur, who is the VP of Sales and Partnerships with WiserTogether. Welcome to the program.
Great. Good morning, Doug. Good morning, Brent.
Good morning.
Yeah, good morning.
Tell our audience about WiserTogether.
Yeah, sure. So WiserTogether offers the first of its kind personalized treatment decision support tool, and it's called Wiser Health. So right now when members are faced with a health issue, they're going to friends or they're going to family or online for help answering really the first question they have when they have a health issue, which is, what should I do? And they're not getting the right information, although they're getting a lot of information. And what happens when they don't get the right information is it drives up cost because they're doing trial and error of treatments. It reduces productivity, which you guys have already brought up on this show, until they find the right treatment that works, and ultimately that leads to poorer health. So what Wiser Health does is we bring together the critical pieces of information a member wants and needs to feel comfortable, confident, and comply with the treatment they use. Currently, we support over 5 million members that have access to Wiser Health across employers, health plans, and exchanges, and the market demand continues to grow for this. As organizations are recognizing it's critical that they fill this void, as you were mentioning, in their offering and help members with reliable, personalized solutions.
Yeah, we're excited about this program that you're doing with SelectAccount. Tell us about WalletDoc and what you're excited about from Wiser's point of view.
Yeah, so we're excited to integrate with WalletDoc. We believe in listening to the market, right, and providing a solution that meets market demand. And the market, especially employers, have been saying for years that they have too many services and they're in different places. And this is hard for them to manage, and frankly, it's confusing for the members. So SelectAccount and WiserTogether are addressing this pain point by bringing the right set of tools in a place that healthcare consumers are already going. So, Doug, you mentioned this, finding the right care at the right price and even at the right place to get that information. John Young mentioned it in the call at the end of last week's show, that we need to continue to logically put the right tools in the right place to support healthcare consumers, and this integration is just a natural fit.
Vineeta, this is Brent. When you look at the rise of, high deductible plans or consumer-directed health plans, this appears to be a natural fit with what you guys are doing, because if the market moves to these higher deductible health plans and where the employee consumer really has to make choices, this coming together between yourselves and SelectAccount makes a lot of sense.
No, you're absolutely right, because right now the consumer is pretty much just fending for themselves. They have more responsibility, financial responsibility for their health care today, and they're trying to answer these critical questions about what is the right care, what is the right price, and where should I go? And having all of these tools in different places just makes it even more challenging for them to try to make that decision. And so what WalletDoc is doing is very innovative in bringing all of those pieces together in a place that consumers are already going, as you mentioned, 6 to 10 times a year.
Vineeta, how deeply integrated is this user experience, within WalletDoc? I mean, and what factored into how you wanted to build this integration into the spending account?
Yeah, one of the beauties about Wiser Health is that it's a fungible tool. And the question you're asking is one that the market is asking on a regular basis, is how integrated should all of these tools be together? Wiser Health is integrated with many different tools. So, for example, price transparency, or in the case we're discussing today with SelectAccount, HSA or FSA or second opinion. And by doing this, we're making the member experience more comprehensive, as well as simplifying the management of these resources for an organization. The key is less about integration. The key is getting the right information in the hands of members now, right? Members are struggling. They're struggling to find the answer of what they should do when they have a health issue. And SelectAccount understands that urgency. They understand that Wiser Health helps the member have a better conversation with their doctor, that it helps the member – sorry, go ahead.
No, go ahead. That's fine. I was going to ask you to step back from this relationship and talk about, your experience. Is with your, members that are participating, with your solution. Do you find younger people gravitating to this more readily, or do you find a pretty balanced demographics?
Yeah, it's a pretty balanced demographic. We get that question often, and I think there's a myth that only young people use online tools, and our engagement data doesn't show that at all. If you spend any time with my dad, who's 68 years old, he's always on the computer, and that's the first resource he goes to for all his information. Another myth that we hear from employers is only white-collar workers engage with online tools. In fact, many of our clients have a majority of their employees in manufacturing plants or in retail environments. And the Pew Research Center actually just released a study that said 59% of people went online for health information last year, and 31% of them were specifically looking for treatment options. So people are going online. In fact, people of all demographics are going online. And since Wiser Health and WalletDoc are online solutions, it's great because we're meeting people where they're already going.
When you go back and let's go back to WalletDoc for a minute, Vineeta, and as you and the SelectAccount team were putting this together, what considerations were given to how this solution would help employers manage healthcare costs within their organization?
Yeah, that's a great question. And so, when you think about them managing their cost, the critical piece in the WalletDoc solution is really helping them understand the right care. And so through the Wiser Health platform, people are able to avoid trial and error of treatments. In many cases, people will go to the doctor will give them a treatment. The treatment doesn't meet their personal preferences. They don't like the side effects. They go back 2 months later. They try something else. And all the while, what they're doing is driving up health care costs for themselves as well as for their employer because they're doing this trial and error. And in the process, they're not being productive. So going back to your conversation earlier around ROI and its measures, we're actually hitting multiple metrics on the ROI by providing the solution, one around just pure hard cost on the cost reduction for medical costs on trial and error, but then also on the productivity piece as well.
Going back to this relationship from a cost standpoint, as Doug alluded to, and also a functionality standpoint, if I'm an employer, do I have to have every component of, WalletDoc turned on, or are there certain pieces of this solution that I can utilize and maybe don't have to utilize the other solutions? Do you have an answer to that?
That's the beauty. I do. So that's the beauty of what WalletDoc has done and what SelectAccount has done is they've kept this very simple. Right, you purchase the entire WalletDoc solution, and you get all of the tools you need in the consumer care continuum. So they haven't created multiple SKUs where people can pick and choose what they want. They've created one bundle that allows people to have all the tools in a scalable place for an inexpensive price. And that makes it an easy decision for the employer. It provides the right tools for the member and simplifies the whole implementation process for everybody.
Is there, and you alluded to some of the demographics and the companies that you work with. Is this kind of a one-size-fits-all solution? Is it more scalable to the larger mid-sized employers? Is there a sweet spot for this type solution?
Yeah, so one of the things that WalletDoc found out is, they thought this was going to be something that was going to be for smaller employers or more of the mid-tier. And in marketing this and rolling it out, what came to their surprise is very large national accounts have shown a lot of interest in the WalletDoc solution. And that really gets back to the pain point that we talked about earlier. People are not wanting to contract with 5, 6 different vendors. They would love to have one vendor that provides an entire solution. And WalletDoc is doing that, making it easier for people to have one vendor that's providing all of the consumer tools. So we're not surprised at all that we're seeing that the market adoption is across multiple sizes of segments for employers here.
Hey, Vineeta, what is the business model for the solution? Is there a cost for people to utilize this solution? If I'm an employer and I'm going to use this solution, is there a cost, or what is the business model?
Yeah, I know there's a couple of different segments in the way WalletDoc rolls it out, and for some, depending on which segment they're in, it is included as part of their services. For others, it is a buy-up service.
Okay. Well, Vineeta, we really appreciate you joining us on the program. Sorry for the connection difficulty with David, but let our audience know how they can find you guys.
Yeah, so you can find us on WiserTogether.com. As you mentioned, we will be at IHC Forum and hosting a workshop, so we would love to meet people there. But if you're looking for more information, you can either reach us through IHC or directly through WiserTogether.com.
All right, Vineeta, thank you so much. We'll have to have you guys back again. Have a great weekend, and we really appreciate you joining us.
Great. Thanks for having us on the show.